Hello, and welcome to the PAMCA Vectorbase Virtual Vector Meeting. My name is Frederick Zielig, and I am the Partnerships Manager for the Global Vector Hub, based at the London School of Hygiene and Tropical Medicine. First of all, I would like to thank the organizers from PAMCA and Vectorbase for hosting this exciting event. I would like to thank all of you for joining us for this session. The Global Vector Hub is an exciting new online platform providing free open access information on vector control and vector research. It has been developed by the LSHTM and ARCTEC at LSHTM in collaboration with the Global Health Network. The three main aims of the Global Vector Hub are to build capacity, to strengthen systems in vector control, and to create a global community of practice. The main features of the Global Vector Hub to achieve these aims focus on data, on networks, and on resources. For instance, vector data can be viewed using maps on the platform or downloaded for your own analyses. In this regard, we are also very keen to collaborate with existing initiatives and projects such as Vectorbase and RMapper. Moreover, we provide a worldwide network of institutions, vector researchers and vector control agents, plus discussion forums. We also provide an extensive database of different resources, such as training and educational materials, vector control guidelines, standard operating procedures, and research tools. We consider the main audiences of the Global Vector Hub to include medical entomologists and vector researchers, health workers, vector control program operators, and humanitarian aid workers. However, we are also open to everyone. In the context of the current COVID-19 pandemic, we decided to launch an early version of the Global Vector Hub, which we called GVH Beta, in June of this year. However, we're expecting to launch a full version of the Global Vector Hub by the end of 2020. This full version will include extensive data, resources, and networking features. It will also include a global directory of training courses in medical entomology, developed by the GVH team and ARCTEC in collaboration with a special program for research and training in tropical diseases, also known as TDR. Just to give you an idea of this directory, about which we are very excited because we see it as a very powerful tool to build capacity and to train new young researchers in medical entomology. As you can see, we have assembled over 120 different training courses in medical entomology from 33 different countries, and these courses are offered in 10 different languages. And as you can see in this screenshot, you can, for instance, select for the different countries, for different languages, for specific keywords. You can also gather more information about the institution hosting these courses. You can find out anything about entry requirements or course fees or the duration. And you can click on external links to find out more and to register if you wish to do so. More generally speaking, we're providing a comprehensive database of accurate and up-to-date resources, such as training and educational materials, vector control guidelines, and research tools. Our resources section on the Global Vector Hub also includes technical documents, laboratory and field technical documents, and standard operating procedures. In addition, we're providing extensive information packs for specific diseases, such as malaria or arboviral diseases, such as yellow fever or dengue, and for specific audiences, such as health workers or researchers, as well as general summary documents for a quick overview. Currently, we have 271 different resource documents uploaded on GVH Beta. As you can see in this overview, there's been quite a lot of demand for the different types of resources and documents. And by far the most popular or the most often accessed document is the Global Vector Control Response by the WHO, which we consider a crucial document of the global response against vector-borne diseases. And I recommend everyone on this course to have a look and read through this very interesting and very crucial document. I had mentioned already the COVID-19 pandemic, and the impact of this pandemic on global vector control efforts has become apparent over the last months. To address this issue, we hosted an online workshop this July in collaboration with the Global Health Network. Our panelists included Dr. Raman Velayudhan from the World Health Organization, Dr. Damaris Matoke-Muhia from KEMRI and PAMCA, and Dr. Grayson Brown from Puerto Rico Vector Control Unit. This online workshop was attended by over 400 participants from 60 different countries, and we had a very lively Q&A session as well. And you can watch the recording of this online workshop on the link provided here. In addition, we have prepared and published several case studies on the current vector control situation, for example, in Guinea-Bissau, Sierra Leone, and Colombia. Also, after natural disasters such as cyclones and hurricanes, we prepared very rapidly situation reports on the vector situation in these affected areas and shared these with relevant stakeholders. We also published an opinion article in PLOS NTDs, which brought together a broad coalition of global vector experts. This article has been mentioned in several external newsletters and has been viewed several thousands of times. And you can read it yourself if you like by clicking on the link provided here. We were also strongly involved in a massive open online course, or MOOC, called The Global Challenge of Vector-Borne Diseases and How to Control Them. This course was developed in collaboration with our colleagues at LSHTM, IVCC, and the Liverpool School of Tropical Medicine, and was extremely popular. It had over 4,000 registered users, and we've received very positive feedback. And we're happy to announce that the material from this course will also be shared on the Global Vector Hub. Furthermore, we hosted a survey on the impact of COVID-19 on vector-borne disease research and control operations. And this over 183 respondents from 47 different countries responded to this survey. And as you can see, there's quite a wide global spread. And if you click on the link provided here, you can read the report yourself. The main findings were that a large proportion of the respondents reported severe impacts on their own work. And it is definitely very interesting to read this report in more detail than I'm afraid I could cover in this short session. This brings me to the end. I would like to thank the rest of our team at LSHTM and ARCTEC. Our director is Professor James Logan, and all of the rest here are also shown. Now, I would like to invite all of you who joined us for this session to register yourself, your work, or your organization at the link provided here. You can follow us on Twitter for any updates. You can also find us on social media, other social media such as Facebook, LinkedIn, and ResearchGate. I should also point out that if you're interested in sharing data or featuring your resources on the Global Vector, please contact us at this email shown here. And if you have any further questions, please do come and find me at the Global Vector booth in the virtual exhibition hall. And with this, I come to the end. I would like to thank our funders, the European Union through the Horizon 2020 project and the BBSRC, and our colleagues and collaborators at ARCTEC, LSHTM, and the Global Health Network. And would like to thank all of you for attending this session.